Not only does Memphis have 2 pediatric emergency rooms, we have an advanced pediatric eye center. To tell you more about this special facility is Dr. Calzada, an ophthalmologist with Baptist Eye Center. Welcome. Petey, this is Dr. Calzada.
How you doing?
Dr. Calzada, tell us about what's going on at the Eye Center and what kind of services there are available.
What we set out to do, and since the first moment that Anita Vaughn called me with the idea of doing something with back then was what was Women's Hospital, that now is the Pediatric Baptist Hospital. The idea that we had was not just simply bringing surgeries like we were doing in the other hospitals, but trying to do something a little bit more comprehensive and more to provide other services that we otherwise were not able to be providing in the community. So what we decided to do was to, in one of the operating rooms at the hospital, at the Pediatric Baptist Hospital, to bring a whole host of therapeutic and diagnostic equipment that would allow us to perform services, procedures, diagnostics that otherwise would have been very difficult, particularly in children. For example, if you've got an adult that comes to our office, we can do a whole bunch of testing to allow us to make a diagnosis and proceed with the treatment plan. But when you have, say, a 1-year-old, you cannot...
Everything changes.
Everything changes. So the difficulty was having the ability to do that while the child was under anesthesia. So we had the anesthesia services, of course, but now you need the diagnostics. And the diagnostics required a significant amount of money and expense and bring it all together. But ultimately, the whole idea was not just to be able to have some isolated diagnostic things, but
to have it all together in one package that fits the children. And instead of trying to make adult equipment and adult facilities fit a child, this is just for children.
And in addition, I'll say, is the issue of a lot of the children that we take care of are not just simply from the Memphis metro region, but from hundreds of miles away. So you would have a family bring a child with a very specific disorder that we'd be able to bring the child, put him under general anesthesia, perform on that single setting all the diagnostic testing, and if the child needed lasers or surgeries or any sort of
everything can be done right then
while the baby is asleep. Wake the baby up, and you can, and hopefully you're done, or you can say the next appointment will be there again so many months afterwards.
That's great. What a great facility. Now, what are some of the common eye conditions that you see with children?
Understanding that I don't do the basic general eye care of children, but the most common things that children have are just needing glasses, or lazy eye, or strabismus, or crossed eyes. But in the midst of all that, there's a host of very specific, perhaps uncommon disorders, but yet very important nonetheless, because the burden of blindness on a child, a lifetime blindness on a child, is a significant issue. So to be able to diagnose and treat early and prevent such a serious consequence to a child and his or her family is a big deal. So in my situation, I take care of retinal disorders, for example, retinal detachments, retinopathy prematurity, which is a big deal now that babies are born. Prematurity is a very common issue now, and the consequences of that.
So there are eye conditions associated with premature children that needs to get addressed as well.
Absolutely. Trauma, then different other sort of conditions like Coats disease that we've happened to build a center for, where we've got, as I said, patients coming from all over the United States to see us.
Well, the take-home message is that Baptist, through the Baptist Emergency Room, Pediatric Emergency Room, and the Eye Center, we can handle issues with children from trauma to congenital issues to pediatric surgery. That's a one-stop shop where they could come. So if a child, and the most common thing I know I had with my children are traumatic events, getting hit in the eye with a baseball or a foreign body in the eye. The pediatric emergency room would be a good place to start, and then y'all could administer to these children.
Exactly. And these children, if they need admission, they can be admitted. If it can be an outpatient care, it can be as an outpatient. But to have all that available within a single location, it's great. It's great for us as physicians and certainly for the families and the patients.
Well, thank you so much for being here today. Enjoyed meeting you. Next, in my Health Matters memo, more information on one of the best ways to protect your child's health.